Welcome back. This morning we're joined by Dr. Mark Hendricks and nurse Rakara Mastovic from Coliseum Medical Centers, and they're here this morning to talk about lung cancer and the low-dose CT lung screening test. Good morning. Thanks for being here.
Thank you.
Good morning.
for having me.
So what exactly is CT lung cancer screening?
Well, lung cancer screening is a strategy to help identify early lung cancers in patients that are high risk for lung cancer before they cause symptoms, to help identify them before they cause symptoms and to a point where they can potentially be curable.
Okay, and then what is low-dose CT screening?
Well, low dose stands for a low dose of radiation. So it's approximately a third of the amount of radiation as compared to a conventional CT scan.
And what are the benefits to doing that as compared to a regular CT?
Well, less radiation means less radiation exposure, which is a less cancer-causing risk.
Okay. So y'all have a pretty special event coming up at the hospital. Can you talk about that?
We do. November is Lung Cancer Awareness Month. So the Coliseum has a special day outlined with 28 slots for people to be screened with a low-dose CT scan. This also includes meeting with a physician for shared decision-making, as well as meeting with a respiratory therapist to help discuss smoking cessation strategies.
And why do this? Why have that day?
Well, lung cancer is very important. It's the leading cause of cancer mortality of all cancers. So it's important to identify cancers early so that they can potentially be curable. Unfortunately, with lung cancer, most cancers are identified at an advanced stage, which makes them not curable in a lot of circumstances.
So what do people need to know going into being screened? What kind of things do they need to prepare for?
There's really nothing necessarily that the patient has to do to prepare for the event. As the nurse there at the event that day, I'll be screening the patients if they meet certain Medicare criteria. Some of those criteria are between the ages of 55 and 77 with a 30-pack year history of smoking, as well as other risk factors can lower that 30-pack year if they've been in secondhand smoke exposure or situations like that.
Now you mentioned ages. Is there a point where people should stop being screened for lung cancer?
Well, typically the age limit goes from 55 to 74, and those patients who have quit smoking within the past 15 years still are eligible to be screened. But once they have stopped smoking for 15 years or greater, generally it's considered to stop at that point.
Very interesting. And I wonder, does heredity, like if your dad had cancer, your mom has cancer, does that make you a bigger candidate, or does that not play into things?
Well, certainly 85 to 90% of lung cancers are related to smoking. The other are certainly related to secondhand smoke exposure.
Yep.
So smoking is the biggest factor related to lung cancer.
I want to thank you both so much for being here and all the work that you do.
Thank you.
We'll be right back.